So the topic given to me today is evidence-based guidelines for knee osteoarthritis. So let me just outline what I'll be discussing today. We are going to discuss about the common myths and misconceptions about knee osteoarthritis, and we will try to understand the evidence-based clinical guidelines for knee osteoarthritis. So this would be the current evidence-based practice guidelines. So as you all know, people with knee osteoarthritis present with some knowledge of their condition, and the knowledge may or may not be factual based. So everybody has an opinion about osteoarthritis. If you look in our family also, everybody will have some knowledge. So as you all know that half knowledge is dangerous. So it's very important to bust these misconceptions firstly, and then you try to practice the right clinical guidelines. So let's look at some myths and misconceptions about osteoarthritis. So I've listed down a few of them. Firstly, people think that knee osteoarthritis is a bone-on-bone condition, which is not true. They also have misconception about knee osteoarthritis, considering that to be a wear and tear disease, which is also not true. So the identity of the disease, the cause of the disease is not true what people believe. With respect to consequence of the disease, people think that exercise and loading will cause further damage, which is again not true. Then people also think that pain due to knee osteoarthritis will inevitably get worse over time, which is again a myth. With respect to the treatment aspects, people have a myth that physiotherapy, exercise and physical activity will increase knee pain, which is again not true. And this is the biggest myth what people usually have. They think that surgical treatment will replace lost cartilage and cure knee pain. So knee joint replacement would be the ultimate gold standard management, or this is unavoidable, this is inevitable, which is again not true. We can very well manage knee osteoarthritis with non-surgical interventions, and this has to be told to the patient. So this is all about the myth and misconceptions what people have about osteoarthritis, and it's important that we break this myth. So myth busting is very, very important in this condition. So now clinicians seeking to encourage engagement with non-surgical interventions should explore and target misconceptions that patients hold about the identity, causes, consequences, timeline, and treatment of knee osteoarthritis. Because we being a physiotherapist, we are the ones who are going to deal with knee osteoarthritis with non-surgical interventions. So it's very important for us to ask the patient about their understanding of knee osteoarthritis, what people think about knee osteoarthritis, what is their understanding about the causes, consequences, as well as what they believe about the treatment options available and what is the prognosis, to identify and target any misconceptions and encourage uptake of non-surgical interventions is very, very important. So now coming to the evidence-based clinical guidelines. So I think final years will very well know what is evidence-based clinical guidelines because I've taken a class for them. So I'm sure they have some idea about evidence-based clinical guidelines. So we are trying to apply the current clinical practice guidelines to treat patients in osteoarthritis. So there are many clinical practice guidelines for management of osteoarthritis. So a few of them I've listed down here. We have the guidelines laid by the National Institute for Healthcare and Excellence, Osteoarthritis 2014. We have the guidelines laid down by American College of Rheumatology, Hip, Knee and Hand, OA, in the year 2019. We also have the guidelines by European League Against Rheumatism, Hip and Knee Osteoarthritis in the year 2013. We have the guidelines by Osteoarthritis Research Society International, Knee OA 2019. And lastly, we have the guidelines by Royal Australian College of GPs, Hip and Knee OA 2018. So now if you look at all these guidelines, all the guidelines are consistent in recommending few things. So few important things which I would like to highlight here is education, advice and information, exercise and weight loss, if appropriate, for all patients as the first line treatment. Pharmacological strategies such as analgesia and anti-inflammatories, passive clinician-delivered therapies, aids and devices for some patients. Surgical intervention for a few patients only if an appropriate course of other non-surgical strategies has been unsuccessful. So if you look at these guidelines very closely, all the guidelines are very much consistent in recommending that education, advice, and exercise and weight loss would be the best line of management for any patient, or rather all patients with knee osteoarthritis. Pharmacological intervention, that is, drugs can be used to minimize pain in some cases only. But majorly, all your patients can be very well managed with exercises, proper advice, and weight loss. And there are only very few patients who may actually require surgical intervention. So the number would be very few. So I'll again try to reiterate this statement. All patients can be managed with exercise, advice, weight loss, and physical activity. Some patients may require pharmacological intervention, and very few people require surgical intervention.